Hi, good evening, everybody, wherever you're joining us from. This is Empower Our Balance, our monthly podcast. It's good to have everybody join us. And if you'd like to join us live in the studio, please, I'll be dropping the chat shortly. You can click on it and actually join us live and contribute to the conversation. We have Kikelomo in the studio and we have Pauline already sitting pretty, looking pretty this evening. How are you today, Pauline?
Oh, thank you very much for that. So yes, I'm feeling okay right now, nice and relaxed. A busy day, but it's Friday. Looking forward to
Fantastic.
the weekend.
Awesome. So we'll just go straight into the podcast for this month. Welcome, everybody, once again. And if you're wondering what we do at this podcast on monthly basis, is actually meant for professional women. This is where we meet, come together to talk about how to effectively navigate the complexities of maintaining harmony in our professional and personal lives. So, shortly, I will be sharing on my screen what we offer as a community. We offer insight, inspiration. In case you're wondering what Empower Our Balance is all about, this is what we offer as a community. Is a platform for growth. We encourage one another to learn, connect, and evolve in all areas of lives. And this is our community pages. We're on social media platforms that we have here listed. Please feel free to join any of our social media platforms. And before we also go into the main discussion for today, we want you to scan this QR code that is on your screen right now. We want us to scan it and tell us how you're feeling today. Maybe you're like me. I'm actually feeling very excited. Today is my best day, so what do you you wouldn't expect anything less. So I will also be putting in my emoji to show you how I'm feeling. So in case you are having difficulty in scanning the QR code, please you can follow the link um, I dropped. It will take you to the board where you'll be able to select any of the alphabet to represent how you're feeling. We want to know how you're feeling, and we'll be showcasing the mood later on. So it's good to have everybody join us. Please drop your name and your location where you're joining us from today. My name is Folake Ungu. I'm joining from United Kingdom, and I have Pauline also joining from United Kingdom. So please, let's hear about uh, your mood. Tell us about your mood by clicking the link or scanning the QR code. Who is in the room? I've mentioned my name and where I'm joining from. So very soon we'll be hearing more about Pauline. If you had joined us before now on this podcast, you must have heard about her, but today is also an opportunity to actually get to know her even better. So Pauline will just briefly tell us more about herself. Uh, I would just want her to briefly introduce herself to everyone so that at least when you're speaking, we would understand from where you're speaking from. Hi, Pauline, are you there?
I am there. I'm here. Yes, thank you for that introduction and happy birthday to you.
Thank
Um,
you.
well, my name is Pauline Barrett. I am a fertility nurse consultant working in reproductive medicine. I've been in the field of reproductive medicine for over 30 years. So I've seen lots of changes from way back in early days and improvements in health and management of couples or individuals who are seeking either to become parents or wanting to know about their fertility health and status and how they can improve their quality of eggs or sperm or enhance their chances of pregnancy. So I've worked in both NHS clinics and private healthcare. I am also part of contributed to work with the Department of Health writing policies and processes. I work with, alongside our, should we say, our regulatory body for the UK. They're called the Human Fertilisation and Embryology Authority. So we govern all clinics in the UK to ensure that the practice is compliant with the needs of infertile couples or
Awesome.
individuals who work with it. So there's a lot to what I do, and I'm happy to take questions as well throughout the session. So thank you for opening this opportunity up to discuss fertility and how it affects us as women in the workplace and for the future.
Awesome. Good to hear from you and all those wonderful experience that you had just shared with us. So, who is in the room? If you'd like to tell us more about yourself, please drop us a chat. And if you'd like to speak, please indicate in the chat if you'd like to tell us more about yourself. We'll take that much later on. So, please drop us your location and your name. We would appreciate that so much. Thank you so much, Showumi, for joining us on today's episode. And today's episode is dedicated to a very critical topic. Pauline had already mentioned something around that. It touches on both professional and personal lives, balancing your career, family, with a particular focus on fertility. Whether you're just starting to think about your future in terms of setting up a family, or you are actively working towards parenthood at this very moment, or you have a family that you're running, whatever category you actually fall into, I'm very, very sure, I'm very confident that you have something to take home today, because we're going to be sharing practical tips that would help you navigate this journey with confidence and ease. So let's just get started. Before we go ahead, we would like you to just take a look at this question. We want to make this session as interactive as much as possible, very interactive for everybody. So, what would you say is actually your biggest challenge? The biggest challenge you face when trying to balance your professional goals and your personal or family aspirations. We want you to share your thoughts with us and let us explore these challenges together. Please drop these on the chat, and if you like to speak, please indicate, or you can simply join us on this platform. We have the links we have the restream link for you to join. To share your video and contribute on our YouTube channel. We have it stated on LinkedIn channel as well. So you can just click on the link and do a very short registration and join us. So I think I'll just start by speaking to my own biggest challenge as a career person who has been in the professional space for over 10 years, still counting. One of the biggest challenges for me is, as a professional, is being able to balance my professional goals with my personal and family aspiration. Is being able to balance it, and in terms of managing my time. Time management is a major challenge, and I believe so many of us are facing the same thing as well. So I'm often torn between dedicating extra hours to advancing my career and spending quality time with family. So this is actually very, very difficult for me, but I've been struggling with this, and that's why we'll schedule some questions to learn from Pauline, who has been in the professional space for over 30 years. How have you been able to cope? For us that have just spent barely 10, is not been easy balancing family and career and still pushing. The pressure to excel in both areas are very overwhelming, very, very overwhelming at every point in time. So for me, to manage this, I've started setting clear boundaries, and I'm trying to also be more present in whatever I'm doing. So if I want to spend time with my children, I would make sure that I'm actually giving them that time, undivided attention. And if it's work, I try to create a space for it and also focus on it, so that everybody kind of have their own dedicated space per time. So let's hear from you as well. Please drop your comments on the chat, and if you like to speak, please let us know for you to be able to contribute to that particular question that we have. We've already met Pauline, and this is actually the overview of what we're going to be discussing today: understanding your fertility, preparing for pregnancy, or what's the best, and the rest of them is, I promise, it's going to be very, very interesting. If you haven't checked your mood, please do that very quickly. Would appreciate you to we want you to actually tell us how you're feeling. So over to you, Pauline. I think without further ado, we can just go into understanding your fertility. This is an important topic to every woman out there. So please, please take
Yes,
it on.
thank you. Right, so understanding your fertility is really knowing your body and knowing some aspects of biology, how your body works at different phases of your life. And if you're considering or thinking about fertility, having children, then it's knowing what your cycles are. What's the best time for you to become pregnant in a menstrual cycle? But let me just go back a little bit and tell you a little bit about the biological side of it. So women, I say female born women, because there are some gender changes, transgenders that come for fertility investigations or inquiries. So if you are female born, you actually have the quantity of eggs you will have for life in the womb, so as a fetus. And approximately at that stage, you have about 7 to 8 million eggs already in the ovaries as the embryo is developing. So it's a vast amount of egg numbers. However, when you're born, this number drops rapidly to about 1 to 2 million eggs. So we've already lost a vast amount of eggs that can potentially become fertilized to be children between fetal stage and birth. So at birth, you have about 1.5 to 2 million eggs. By the time we start menstruating at puberty, where our numbers have dropped rapidly to about 300,000. So you can see the quality or the quantity, shall I say, diminishes quite rapidly before you're even thinking about having children. Well, by the time you're in your 20s, early 20s, the numbers are between 150 to 300,000 eggs. So by the time you're 37, approximately, there's about 10,000 eggs remaining. Now, it might sound a lot, but each month that we have a menstruation, we lose about 100,000 eggs during that month. So one follicle, which contains the egg, pops, releases. However, there is a bunch of follicles that are trying to get to the top marker and they don't make it to maturity, so they diminish. They become ingested, if you like, in the body of the uterus and the body of the ovary, and they never get used. So we lose about 100,000 eggs each time we menstruate. So quality of the eggs that we have, remember they're there from birth. So they're getting older, they're older than we are. And quantity is diminishing rapidly as well. For men, however, the slide you're showing, I'm going to come back to that in a second. For men, they regenerate sperm every 72 days, so approximately just over 3 months. Women are born with the egg numbers, and you can't regenerate these. They are the cells that do not regenerate themselves, like blood cells or nerve cells. So we have to look after our healthy follicles, potential eggs, as much as we can. The next slide that you were going to show there shows a picture of an actual ovulation process. This was taken during a laparoscopic procedure, a hysterectomy. So while they were removing the uterus of a woman, they could actually visibly see ovulation. Now, the red structure there is the follicle, and the yellow colored is the egg coming out of the follicle during ovulation. So that's what happens to us every month that we ovulate. And by the way, not every month do we ovulate. Even though you have your menstruation, you may not actually ovulate and release an egg each month. So this picture shows an actual ovulation in process, and I think it's an excellent capture of this happening. It's something that you would never see with the naked eye anyway, but it's a very intriguing image there. So how do we look after ourselves, or what do we prepare ourselves? It's, as I said before, knowing your body, knowing how at the age of early 20s to early 30s is your most fertile time, because you have the most quantity of eggs in your egg sacs, and they are at the most healthiest stage they can be. Fertility naturally declines, and all the stats will tell you fertility drops at 35 years of age. It actually drops a lot earlier, and we're seeing that more and more in the general population of women that come through for fertility investigations. But it would be interesting to find out what the fertility rate is in the natural whole population. It's something that we can't capture, because women won't come to a fertility clinic until they are struggling to conceive. So knowing your body is important, knowing what happens in biology, and knowing that the best time to think about pregnancy is early as possible.
Okay, thank you so much for that analysis. I believe is quite educative for anyone that will actually want to learn more about how female fertility works, right? Thank you so much. We wouldn't want it to be too educational or too
No.
technical. I believe you've been able to break it down pretty well. But if you'd like to learn more, please, Pauline is always available. I'll be sharing her details much later. Please contact her for any kind of clarifications that you would like to make at any point in time regarding your fertility. Thank you so much. So quickly, I would like to ask why you think a lot of women don't really ask questions around their fertility until they are actually ready to give birth or read about it. Well, what do you think is the problem here? Is it society? Is it parental responsibility? How can we change that before we go into how to
Yeah.
actually prepare for pregnancy?
It's a good question. It really is a good question. And I think it would be a difficult one to answer. I think it's a case of you don't know until you don't know. If women are of a younger age, they're thinking about their education, first of all, at school, then going to university. And becoming pregnant is not a priority at that stage of their life. Then it's building a relationship with their partner, or they also can take the solo journey and go for single parenting. But until you meet your partner and maybe settle down, and what does that involve? Does settling down mean you have your build your career ladder, your career pathway, and finding the right partner is very important as well. And at that time, I mean, how old would somebody be when they reach the stage where they think they're ready for a child? It could be in the 30s. And particular in this day and age of the society, our targets will always be to build a career, establish a financial backing, so you have got money to have somewhere nice to live, where you could possibly bring up children safely. And also, as you said before, the challenges facing women who are career minded and still also think about having a family is what to put first. So it's a question that would be ideal to ask a lot of women as early as possible. What are your thoughts? When would you think of having children? But it's probably not an answer that they could give you at that stage. I know lots of young 20, 30-year-olds who are not ready to have children and don't know if there's a problem in conceiving, which is where somebody like myself would come in. Learn your fertility now as early as you can. in your 20s to make a choice, to make a choice of what you want to do when you want to do that as well. So it's important to learn early.
Fantastic. Thank you so much for that. So we just quickly go into how to prepare for pregnancy. What's best for every, I would say for every category of women that we have, like a younger generation, the middle-aged women, and the older age women that are still looking forward to having children.
Yes. Okay. Thank you. So yeah, all ages. So we take the young 20s, 20-year-olds. If you're not ready to have a child, then the best thing is to do is to make sure you're healthy anyway. And that's the generalization of your health. Eat well. A good diet is very important for all aspects of your life. So a healthy diet containing a balanced diet, let's say, containing your proteins, your carbs, your vegetables, your fruit. So good, healthy, balanced diet. Try and avoid too many red meats, but you still need to include your proteins. Not too high on the carbs either. So again, we use that term balanced diet, and that's what's important. Drink lots of water because water is needed for the cells of the body to ensure that there is a good flushing of all your organs, and avoid unhealthy habits. Now, by that, I mean smoking, cigarettes, vaping, because we're unsure of the effects of vape on the body, and avoiding excessive amounts of alcohol consumption. For men as well, alcohol consumption is pivotal on the healthy sperm, and moving on for that, the ones that are viable to fertilize an egg. Avoid using recreational drugs, all recreational drugs, because they damage the cell, and the egg and the sperm are single cells, so they will damage the cell formation. And exercise is good, whether you exercise regularly or intermittently. Even walking is a good exercise because it regenerates the blood circulation in the body. So healthy diet, avoid recreational drugs, avoid smoking, avoid excessive amounts of alcohol, and take vitamins and multi supplements, because we do find our body doesn't regenerate them as quickly, so additional supplementation is good. Sleep is an important factor. Good 8 hours sleep each night, and avoid stress as much as possible. No, stress is always there in our lifetime, so avoid stress. Stress and fertility don't go well together. And for me, I would really take home message here is find out early, and I'll keep going back to that. Find out about your fertility early, then you can take control of your choices and moving forward in the future. If you are also not ready for becoming pregnant, as the next section says, explore what to do. So you're not ready to become pregnant, but you know being a mother is something that you will desire to, you can also think about preserving your eggs as a female born, or preserving or assessing your sperm analysis to find out what your quality of sperm is. So egg preservation, a lot of people know it as egg freezing. It's going through fertility treatment, collecting the grown mature eggs and banking them for future use. So there are ways that you can maximize your chances of pregnancy in the future if at this point of your life. For young girls, probably not a first step option, usually in their 30s, but ideally if you are thinking about freezing your eggs, the best time would be before you're 35, as the quality of the eggs diminish quite drastically at that point. Superfoods for men is ideal, antioxidants, berries, lentils. So if the gentleman has a woman in his life, then they can encourage him to eat healthily as possible. But men can learn how to cook and look after themselves as well.
Thank you so much, Pauline. So in checking, how would women go about checking their fertility status as early as in their 20s? What's the approach? Because a lot of people aren't checking because they don't even know how to.
Absolutely. Absolutely. It's not knowing. And as I said before, it's not knowing what you don't know. But checking your fertility is a very simple step to take. After you've had a, I'll give you an example of my program. I conduct a full history taking of the female. If she has a partner and they're both coming forward, so a history taking of their current situation, their health, their future plans. And then we offer a blood test to the female. The male will be offered a chance to have a semen analysis. So it's a sperm count and assessment. So for the female, it's a simple blood test. It's called AMH and it stands for anti-malarial hormone test. It's almost a gold standard really for testing. So you can find out what your AMH level is anytime you wish to inquire about it. The AMH gives you a reading of your levels, and this will indicate a high level. Then you've got quite a bit of time on your hand for your fertility exploration. A lower or mid range, we could indicate that maybe trying for a pregnancy earlier than delaying it would be beneficial. However, if you find that there is a low AMH reading, then advice will be given according to that. An example of a level is somebody in their early 20s may have a AMH level of, say, 60. So a good level. However, a woman in her 40s may have a level of 5. So you can see the vast difference there. So the earlier, again, you find out what your AMH is, through a blood test, the more options you have to make the choices that's going to be right for yourself.
Thank you so much. So it's just a simple blood test, as simple as that. Really?
Simple blood test. Yes, absolutely. And to support the blood test inquiry, we can offer a ultrasound scan because that gives you a visual observation of how the ovaries appear. It's an internal vaginal scan. So we do a internal vaginal ultrasound scan. We can visually see the ovaries. We can count the egg sacs that the woman has at that time of her reproductive age, and again help them make a decision of whether to move forward sooner than later with the decision to start a pregnancy. So
Okay,
it's a simple thing to do, but I'm glad we've got the opportunity to bring it to the forefront. Really, it is simple to find out now.
Awesome. And this would help women to balance their biological clock and career.
Absolutely.
Because, if you're having some sort of delay in getting a partner, and I think it would be fantastic if you check your fertility status and you're able to know what is actually going on in that sphere. So you are able to make informed decision on time as to, okay, am I going to freeze my egg? Am I going to go through abortion? Do I have high fertility rates? So you are able to make decision on time while you wait, right? Are you able to speak alongside that, maybe more clarification on what women whose biological clock aren't that on their side anymore and they have career to also look at the same time?
Well, if I have an example of a young woman that came forward, she already had a child who I think at the time the child was about 6. So she was thinking about the future. She didn't have a current partner at the moment. So she wanted to look into freezing her eggs for when that time came. So following the consultation, I took a full history and organised for her to have a blood test done. And these tests you can do at home. So I ordered the test and send the requirements to the lab that I'm affiliated with. You receive the packet of the test kit at home, do a finger prick test and send it back. I get the results and then we discuss the the analysis. So she did this, and we communicated shortly following. It takes about 4 or 5 days to have this completed as well. However, the results came back indicating that she had a low ovarian reserve. This was very, very upsetting for her, because her plan was to extend her family at some point when she was ready for that. Having a low ovarian reserve, I think the levels were about 6.7. She was 33 at the time, so it was extremely low for her age. We then organised for her to have an ultrasound scan. I organised for an ultrasound scan to take place, and it confirmed the findings of the blood test, which that is, as I said, the gold marker. Her ultrasound scan showed that she only had 5 follicles, egg sacs left in her ovaries. So freezing her eggs would not be an option for her. The most effective treatment would be to have immediate IVF treatment. And I'll talk a little bit about what that might involve. So I counselled her, because it was devastating news. It wasn't what she expected to hear. And the outcome is that if you are going to consider freezing your eggs, ideally at the time of the collecting of the eggs, a small operation. 20 eggs is recommended to have in storage to conceive a pregnancy. So only having 5 follicles, she may have to have this surgical attempt, fertility treatment, 5 times maybe, to accumulate the number of eggs that she needed. But also, if you think about only having 5 follicles at the time, the quality of those will be absolutely affected as well. So they may not be viable eggs suitable to freeze. So deciding on parenthood, go back to the beginning, is do it as early as possible, just to make the inquiry, to know what you are. Almost like having a fertility MOT. Find out what's happening with you. You do it with your cars, your vehicles, you service your electrical equipment. So look after your body and find out how it's functioning.
Awesome. So, are there other advice? Do you have any other advice you would like to give to women who are not ready for parenthood? Or what's the action plan? Or what you have said
Yeah.
so far, is it all exhaustive? Like, would that cover everything?
And the consultation will cover the majority of what we need to find. And you will find out a lot about yourself, the actual client coming forward. I'm a fertility coach as well, and that's what I do in my private company. So I have the experience, I have the exposure to fertility clinics. If treatment is needed, I can instantly refer you. I'm still working in a private fertility clinic now, so I do internal referrals. But it's just making that first step. And a lot of women, young women, who just think, oh, I don't need that now because I don't think I'm going to have problems getting pregnant. But you don't know until you make that first inquiry. Now, if you do find that you're interested in discovering what your fertility status is, do that as soon as possible. If you do need to have fertility treatment, and cost of fertility treatment varies throughout the UK, definitely throughout the world, but within the UK, a standard IVF fertility treatment can range between anything between 3,000 to 8,000. Now, if you knew what your status was before, you can take action and take back that control. And rather than wait until you are then struggling to conceive, and we determine infertility as being the inability to conceive after 12 months of regular intercourse. So if it's 12 months you've been trying to become pregnant, there may be an issue. So that's what you need to explore if you're obviously in a relationship. Both you and your partner will need to have tests and investigations. But again, if you go back 10 years, 15 years, and make that inquiry, you know how long you've got before you might be in that arena of struggling to become pregnant. So my philosophy, my message to many women is just to take a test, make an inquiry, see where you stand now, and avoid the expense of a possible treatment cycle later. Although there are very many clinics like the one I work with who are there to help you as well, but it can be quite costly.
Thank you so much.
Please, can I ask a question?
Yes.
Pauline, I just want to say thank you for the more or less like the education you have given us around and all. But I want to ask around for you to just shed more light around secondary infertility. That is for someone who are out and then certainly without being on any family planning, any form of family planning method, and they find themselves not being able to conceive again. Would you want to just shed light on the causes, the possible causes of secondary infertility?
Yeah, absolutely. Yeah, that's it. Thank you for that question. Secondary infertility often gets overlooked because people who have children already, certainly maybe the false impression that, well, you've had one before, so you'll have one again. But there may be some defect in either the female or the male years later that, shall we say, makes it difficult for conception to happen again. Now, it could be male factor, and some of the times it is male factor. The sperm count may have diminished, the quality of the sperm and the inability for it to fertilize the eggs becomes evident. So a semen assessment to have a look at that. Maybe the lifestyle of the male has changed. It could also be, things like a very stressful job or the environment that the male works in. And we find men who are in a occupation, in a career where they are sitting down a lot, such as taxi drivers, long distance lorry drivers, even men who are working in the office. You are sitting there, or they're sitting down the majority of the time. The testes are then too warm and they fail to function as effectively as possible. Testicles are always outside of the body, and so therefore they need to be cooler. So if your partner is in a job that's office-based or driving all the time, that might diminish the quality of the sperm. And you won't know until you have it tested. For women, if there's a risk maybe of a pelvic infection, it could damage the tubes. So therefore the egg cannot transport from the ovary to the tube, then to the uterus. So underlying undefined pelvic infections could cause secondary infertility. As well as the age of the woman. Again, we talked about egg counts. So if you're over 35, 36, 37 or early 40s, then it may be the quality of your eggs as well as the quantity is deficient. So it's not generating good quality eggs each month to conceive or aim for fertilization to conceive a pregnancy. So there's lots of different factors for secondary infertility. There also may be where the embryo implants into the womb. There may be uterine anomalies that are coming through. There may be presence of fibroids that are preventing the embryo from implanting. So again, ultrasound scan will determine whether there's a fibroid in the uterus in the way of where the lining is, or it may just be what we call the muscle of the uterus, may be defect as well. So if a woman has had a cesarean section in the previous pregnancy, that could also possibly cause some prevention of implantation in the right place as well. So doing the consultation, learning the history of the female as well as the history and lifestyle of the male partner will shed some light on what could cause secondary infertility. Or it could also be unexplained. And unexplained presents for about 20% of couples coming through for infertility. There's no known cause.
Yeah, thank you so much for all of that. I mean, a few of those points are a little bit new to me, like the part, the what could happen as a result of working long hours, particularly for the male. That could affect fertility, because most men, particularly maybe professional, who has to be in the office for a very long time, and so that is something, because mostly it will be women that will be running around to see what is wrong with their body. I actually have someone that I know personally who is actually going through this, had a child, and never has ever been on any birth control pills or any form of birth control method, but has been unable to conceive. And she has made several efforts, and it's been unsuccessful. So like you said, there could also be some unexplained causes, but then I just felt people need to know that also. I mean, that could happen. So yeah, thank you for sharing that.
You're welcome. And just to add to that, male infertility has risen approximately 30% in the last 10 years. Male infertility, so failure of men to be able to achieve a pregnancy with their partner. So there is something. Is it environmental as well? There's stress, there's a lifestyles, there's environmental issues. We do try and guide our patients to avoid processed foods because of the packaging it comes in. The packaging is always plastic formed and quick, easy meals into the microwave, and those are the effects. Those effects from that can have an effect on the actual quality of the eggs that we get. So, busy lifestyle, high stress levels, quick and easy meals, all these aren't really productive in women and men of our generation, if you like. In the old days, our parents always cooked a fresh meal, so our families always had a meal cooked. Very times we just see my grandma popping in a microwave meal. So there was a difference in our lifestyles over the generation, and our life is made to be such an easy way because there's so much other things going on around. It's the aim to work, but it's not healthy for our bodies, and it can have a reflection on your fertility ability as well.
Thank you so much, Pauline. Okay, so just a quick interlude here with this question before we go to the very last portion of our discussion. Pauline is an active member of this community, so if you're live at the moment, if you're joining us right now, you could actually contribute by dropping a response to this, or if you're eventually streaming and we are already offline, you can still drop your comments, or you can utilize the Google form that I dropped on the chat platform to actually ask your question if you want it to be very confidential or you don't want to drop it right now. Please feel free to drop it with us, that because Pauline is a fertility coach. He could actually also respond to pressures or difficulties that you're having in managing some other things aside medical issues when it comes to fertility. And what I actually picked up, what stood out for me from what Pauline has been saying, is the contribution of stress to women infertility, right? If you're stressed up and you're trying to have a child, I think this has a very important role that is playing in your inability to conceive. So again, managing that aspect of your life is also very important. Having someone to talk to about some of the concerns or questions that you have in balancing preparations in having children, and then side by side career responsibilities, especially when you're not speaking with someone with wealth of experience. She's able to share with you how other women have been able to navigate these same challenges or this challenge that you might be facing in terms of balancing your preparations and your career responsibility. It could be around timing, work-life balance, or how to talk to your employer. Share your thoughts. We want you to share your thoughts with us. Is either now, or you could actually share it with us later. And if you are also joining us, if you're just joining us, please drop your location and your name. We would like to hear from you. Please, we want you to be part of the program. So right now, we just go to the last portion of our discussion, which is how can women manage the stress of fertility treatment while maintaining their career? I think you have some interesting scenarios to share with us, right, Pauline?
Yes, again, it's when we said at the beginning that society now is the aim to prosper, to gain as your career as early as possible, and we keep on that ladder and excelling to a point where you're comfortable either in your career, and then you forget about your own life, your own desires of becoming a mother or a parent. Now, how do you manage that? If you are in a workforce at the moment, taking time out or asking for time out to have fertility treatment could be a difficult conversation to have with many employers. One, you may feel that you'll get a negative response, because if you're trying to become pregnant, that means they're going to lose somebody from their workforce. And as a organization, as a company owner, it's probably not what's going to be the most priority in their mind. But it's something that is important to you, and it's a right to have a child and procreate. So you have a right to have this lifestyle. And if it involves a third party, like a fertility clinic or a fertility unit department, you have to have time to go out of your work environment to attend your appointments, your investigations, your treatments. For women who are in a workforce at the moment, I would say to them, find out if there is a policy in place in their HR department for supporting women who are trying to conceive. What does that policy involve? Does it allow time out of work to attend appointments, to attend investigations, to attend actual procedures, operational procedures? And if so, how many hours are they allowed to take out each month, each quarterly? Do they offer flexible hours so that you could have appointments in the late morning to early evening if you have an early morning appointment at your hospital or your clinic? It's finding out what that employer's policies and thoughts are. Again, hopefully these things are improving, and there is a company called Organization Fertility in the Workplace who is acting very hard to ensure that employers do have a fertility policy in place. By law in the UK, you don't have to, as an employee, give women time off to have fertility treatment. But hopefully these are things that are going to change, along with the menopause challenges and such like. So it's supporting women's health in the workplace. Now, if you have a policy in place, that's going to be inviting to any woman, any female or even male who is considering fertility treatment, because if they become pregnant, go on maternity leave or paternity leave, they will come back to that employer. So you're retaining your staff, and usually it's staff that have been there for a number of years that are pivotal to the business and making the business successful. So you want to keep the staff there. So recognizing that there is a need to be flexible in attending appointments is going to benefit both the company and the woman as well. Because if she's struggling to have time off, a lot of our women, they will tell me, oh, I've taken annual leave, Pauline, just to be for these appointments. I've taken my overtime just to be for these appointments. So that heightens the stress levels, because they're trying to become pregnant, trying to be secretive at work, trying not to have too many questions posed at them, and trying to balance that environment. I don't know how they would do it, to be honest, because it must be difficult in many occasions. But at the same time, I do encourage them to think about their mental well-being. And the other speaker was talking about the stress and uncertainty, it can cause a detrimental effect on your mental health. So you've got to ensure that you make yourself a priority and control what you can control. Approach HR, see if there is a friendly buddy in HR that you can become confident with, and seek support as early as possible. So that's what I would advise for women who are trying to maintain their career and look into fertility treatments. See what is on offer in your own organization and be brave to talk about it, but also be selective as to who you approach.
Thank you so much. Okay, so again, talking about how women can actually balance career and the home front. Given your years of experience, we'd like to just ask a few questions around how you've been able to balance your professional life and your personal well-being at the same time. So how do you prioritize tasks, set professional boundaries, and maintain personal well-being? We want to learn from you.
Yeah, I think setting your boundaries is recognizing what you want to do as your career, as your profession. And luckily, I found one that I totally enjoy, because it's been, this year will be 35 years of being in reproductive medicine. And I've been fortunate to work with so many honorable people in the profession, professors and deans and consultants, and I've learned from them. They've shared their knowledge and experience, and with that, I've come to recognize what I want to do, what I'd want to become, and been given the openings and opportunities to explore further career development, educational levels, gone on to do diplomas in research, PGDs in research studies. I am a professional speaker at big events. I think it's having a passion for what you want and keeping that passion within you. Maintaining a personal life it seems to have worked. I have children of my own, and while they were growing up, I think you mentioned it before, Felix, that you know when your work needs to be done, your professional work, and you do that. But looking after your children is also important. So they do have you in their life as they're growing up, as their provider, their guide, their teacher, their advisor. So you play multiple roles, but it's also the fact of enjoying all those aspects. And I enjoy what I do. So I think they get the happiness from me. They've had the happiness from me because they're all grown up now. And so you find a balance in that, and moving forward and moving on in whichever way. A lot of people will, as I say, go on to more professional development and gain the most of it. So it's, for myself, I think it's been quite easy. And I say that now because I've got to where I want to be, and I've always excelled without much difficulty. So I've had encouragement from the people I've worked with, the clinics that I've been involved in. So again, it's support from your network, your employees, your colleagues, and I benefited it and totally enjoy what I do, and thankful for the help and advice that I've had in between.
Thank you so much. We have this feedback from Kike earlier on. The greatest challenge I have faced as a professional career woman and mother is to be able to manage that delicate balance between giving quality time to my children and pursuing my ambition. Kike Lama, would you like to, has this been going, any progress or anything we could learn from you?
Thank you for that. I think it's one of the struggles that all of us have to go through at one point or the other in our career, particularly as you grow and maybe you're rising within the ranks, and then your responsibility is becoming more and more, and you're sort of asking yourself the question of when can I really draw that line? You when is enough actually? What exactly is enough for you? Because the more you rise, the more time you need to dedicate to the work to be able to prove that you have actually merited that right or that opportunity that has been given to you. So there is always that internal struggle. You may not really show it, but for a man, they will not have to really think twice about taking the next promotion coming. But for a mother, you have to consider that to say, how will this impact on my family? I remember a time in my professional life when some period within the month, we have to be getting home as late as 11 p.m., 12 midnight, sometimes, that very, very late hour. And at the time, I also had very young children. So you have to, what has helped me during those periods to be able to have a healthy balance was really the blessing of having support system, reliable support system, because you need to be able to have people that you can trust to leave your children with, and also a very supportive partner.
Yeah.
Because if you are not able to build that relationship with your husband, such that he will be able to give you that needed support for you to be able to thrive at work, I think that struggle will be there. And also having people that can support you, people that you can rely on, so that you can build a healthy environment for your children. And that is how I was able to manage that period of my life when my work was really, really demanding. And it was necessary for me to do all of those in order for me to be able to rise within the organization. And so those were just some of about those two things what were critical in helping me to navigate that period.
Thank you so much, Kikelomon. Before we go into the next question we have for Pauline to learn from her, thank you, Esther, for joining us. You can actually private chat me your location, where you're joining us from, but it's good to have you join us. If you also like to contribute to the ongoing conversation, please let us know. Pauline, you had actually mentioned something around employers, making certain regulations or making certain policies around women fertility treatment or fertility generally, or both male and female. So what else do you think institutions can do to better support women achieving a healthy work-life balance, particularly in workplace, given that you're a professional person? Yeah.
Yes, thank you. That's again, it is understanding the needs of women as they are struggling to conceive, and the effect on their mental health well-being is important. Having the right structure in place in a workplace, having a suitable structure in place, shall I say, not the right one, because it won't fit every organization. But things like allowing flexible working hours, allowing compassionate leave if a fertility cycle ends in an early pregnancy or an early pregnancy loss. So, somebody may go through a fertility treatment and it's successful, they have a positive test, have a scan, and then lose a pregnancy in the first trimester. You can't just go back to work the next day and everything's fine. So it's understanding what they're going through, and be supportive of that. So compassionate leave at various points. Also compassionate leave. I use the term compassionate leave, but there may be another title for it. But a leave if a pregnancy cycle fails, because that is a loss. That's a grieving process that woman may have to go through at that point, and accepting the outcome of a successful cycle. may have had to go through a surgical procedure to remove a pregnancy that's failed. Now, it's also part of, so it's all part of a process that needs to be recognised and understood. Parental leave or parental leave for men is something that they could put in their policies. Openness within an organisation, allowing opportunities for women to approach HR with their issues or their concerns about going for fertility treatment. So it all balances up into that policy making process and understanding the needs of women as they're going through fertility treatments. It's a difficult thing because you also got to recognise the needs of the business.
Awesome. Thank you so much, Pauline. Thank you so much. I think you've already given us some personal strategies that you found most effective. Anyone in particular that that actually stood out for you that you believe every woman out there should tap into?
Recognizing what they want themselves. So accepting what your own needs are, your own desires, and
Awesome.
and that will empower them as well to know if they are wanting to have a child and will need to have fertility assistance, that they should have a right to have that opportunity. Definitely.
Any specific advice as we're trying to wrap up, just bringing everything to a close, to give to women aspiring to fulfill their dreams about setting boundaries and prioritizing their goals?
Yeah.
Any
What I would say is also, the same thing is recognizing what you want to do, what you want in your life. I had a woman a couple of years ago who had achieved all she wanted in her career, built a business, became a company owner, and she was 49 and trying to conceive. She didn't have a partner, so she was looking to become pregnant with donor sperm. And by that time, as I said before in the introduction, the quality and quantity of our eggs had diminished. I said to her, "Why did you leave it this late?" And she says, "I just forgot about myself." So that is an important thing to take away, is don't forget about your desires, your needs and your wishes.
Awesome.
You are absolutely important. So it's all about work and career. Address what your needs are as well.
Thank you so much. Thank you, Showumi, for joining us today and for contributing to the discussion. Thank you so very much. And we would like to tell everyone that we have our previous episodes on the YouTube channel. Please do listen and subscribe to get notification of our upcoming podcast at every point in time. Please, this is our feedback form. And if you go through the chats, we have the form also stated, like we have the link dropped on the chat for you to go through to actually document your attendance and give us feedback. Or if you have specific question, please do ask us. And if you like to be a guest on this podcast to share your experience, especially as an experienced professional, if you want to contribute to younger professionals navigating the complexities of balancing their personal life and their professional aspirations, please do fill the feedback form. You can scan it, you can go through the link in the chat. We would love to hear everybody's contribution at every point in time. And yes, we always I give back my professional expertise to members of the community as a digital marketing expert. I specialize in growing businesses digitally, and I also specialize in building websites and integrating into the social media platforms. I customize, I'm into branding to create that brand identity that you want for yourself. And Francine has been a major contributor, an active member of this community who shares ideas around well-being and organizational change. And last episode was me crafting a website mock-up for her, conceptualizing her consultancy business. And this month is actually for me to implement this idea and turn it into an actual website, which I have been able to achieve, and I'm so excited to share what I have done. So far, we're still working together, but we would always provide feedback here. This is her website. If you catch up on our previous episode, you will see a copy of the mock up when it's yet to be implemented. And please, if you would like me to give any professional expertise around digital marketing or digital growing your business digitally, please fill our feedback form, be an active member of this community, speak to me at every point in time, and definitely I will be available to provide my expertise at no cost. You might not necessarily want to build website. I know other women that I've scheduled meeting with to just talk about what they do and how they go about it. I will be dropping the link for us to actually go through properly. I believe we're able to see my screen. Did we?
Yes.
Yes.
Yes, lovely. Yeah,
Yeah. Thank you so much.
beautiful.
So, please, we also giving out voucher today if you're located in Nigeria. And if you're interested in the voucher, the zzshopelater.com link that is proudly sponsoring the voucher. Today is my birthday, 50,000 voucher. But you have to answer our question as we wrap up. Tell us the product and services on the web page in less than 1 minute. If you are able to meet up with that, then you will be our winner. Only open to Nigerian viewers, and it's open to those who join us live, not those who are streaming. Tell us the product and services of ZZ Shop Later e-commerce platform, and then you would be a 50K voucher winner. Thank you
So
so
if I
much.
win, will my product be delivered to the UK?
Uh, Deliver to UK is actually open to only Nigerian viewers at the moment. Uh, Nigerian participants in this podcast. So thank you so much. We've actually spoken about Empower Balance as a community. Please we would appreciate if you could have other women join us on monthly basis where we could actually discuss things that are very beneficial to our career growth and personal well-being. This is our mission. You can also go through the website, the event website, to learn more about us. Again, feeling is important. We want to know how our participants are feeling. Please drop your feeling, how you're feeling per time, and let us know how we can actually contribute to uplifting your spirit. Thank you so much for joining us. Let's connect. Who is in the room? In case you want to contribute, please let us
Okay,
know.
okay, maybe before we go finally, is it okay for those of us on the live stream to say happy birthday to Folake today? Our
Definitely.
spectacular host. Our spectacular host. Let's just all just say happy birthday Folake together. Let's say 1, 2, 3, go.
Happy
Happy
birthday,
birthday
Falake.
Folake.
Thank
Have a
you.
great
Thank you.
time.
Bless you.
Thank you.
Have a wonderful celebration. We wish you many, many happy returns. Yeah.
Thank you. Amazing. Thank you all for joining. I believe we've been able to go home with one or two important tips that we could actually use to better move our career and our personal lives forward. Thank you so much, Francine. We believe when next we call upon you, you'll be willing to come over and share your thoughts and your ideas with us and learn from you. Thank you so much, Kikelomo. Thank you so much, Esther. Thank you so much, Showumi, for joining us as well and being an active contributor. Thank you so much, everyone. This is me saying goodbye if there are no other comments.
Thank you very much.
Thank you,
Thanks.
everyone. Thank you, Pauline. Yeah.
Thank
Thank you,
you.
everyone.
Bye-bye.
Nurse Showumi, thank you for connecting.
Thank you. Bye.
Esther as well.
Bye.
Thank you. Bye.
Great weekend, everyone.
Have a
Yeah,
wonderful
great.
day.
From here. Bye.
Yeah.